Hello everyone, greetings of the day to all the members of Gujarat branch of Avota. Myself Dr. Rajita, founder of Blessings Child Development Center and an eminent speaker of Blessings, a YouTube channel. First of all, I would like to thank the Gujarat branch of Avota for giving me an opportunity. So today's topic is innovations in occupational therapy for inclusive development in school. So the topics which we are going to cover today are: what is inclusive development in school, that is what is inclusive school, what are the importance of inclusive school, and how to implement the inclusive development and how to implement it in school, what are the steps to be implemented for it. So coming to the inclusive school, nowadays the schools are like inclusive schools are started, but nowadays more schools are like special schools and mainstream schools. This is differentiating this kids with disabilities and typical kids. Okay, so inclusive school means placement of the children with disabilities with the typical children in mainstream school. So inclusion refers to the placement and membership of students with disabilities in general education. So school is a primary setup for an occupational therapist. Everybody knows the role of an occupational therapy in the school, but it is very little known. We have very big roles in schools, that what we have to do in school. So today we are going to see that what are our innovations, what would be our innovations, so that we can make an inclusive school and mix the children with disability and typical students. So coming to the importance of inclusive school, what happening now is a special school and mainstream school is differentiating the kids with disabilities and the typical children, as I told you earlier. So if we go with the idea of inclusion, the confidence level of the children with disabilities will increase because they will be seen equally with the typical children. So they will be more confident, and the next thing is the quality of learning will be improved very much, because in special schools they are not teaching much. In mainstream school the quality of education is good. The quality of education will be equal for the disabled children and for the typical children. So there will be no partiality between the typical children and the mainstream children. So it will not only, inclusive education is not only about improving access and opportunity to the kids with disability, it is also about making impairment less central to the way they are viewed by the society and by himself or herself. So this is the main motto for the inclusive development, that they should not be seen differently. Okay, and next is they will also get same opportunities as mainstream students are getting, because they will also get same knowledge and they will be more confident because they are learning with them, and the communication will increase. In special school they are only having a small group of children to communicate with, and with the same community of the children, means all the children are disabled in any or the other way. But if they are in the mainstream school, even that children will get more opportunities and more communication ideas with these children, and these children also will get more ideas. And it will also not benefit only disabled children, but it will also benefit the mainstream students also, because the way of teaching to disabled children is different, because they need to be practical. Okay, so see, visual learners, everybody are visual learners. If we watch movies we remember more, if we read then we remember for less time. Okay, so we need to use everything visual for these children, so that the mainstream students also will get benefit with this. They can also learn practically each and everything, so it will be benefit for whole society. And awareness also will increase in the teachers and society also if we will go for inclusion school. Now coming to our next subtopic, that is how to implement this inclusion in schools. See, now here there is only not a role of an occupational therapy to implement inclusion. It is whole rehabilitation team. There are 8 members in rehabilitation team. So it is the work of whole rehabilitation team to work to enhance this, and in which now we are going to see that what is the role of an occupational therapist to implement this. What innovations we can make for an inclusion school. So first and foremost, our work is to assess each and every child, because first we need to identify the problems. Once we know that this child is having this impairment, then we can work on that. For example, if a child is having tactile hypersensitivity, so we can make modifications, we can make environment modification, we can make accommodation, and we can give him equipments according to that, so that he can cope up with the mainstream students. Okay, so first and foremost is assessment. We need to do the whole assessment of each and every child. We need to mention the problems, and we need to make a table that these are the modifications done to be done in this class, these are the modifications to be done in the structure of the school, these are the modifications to be done to his bench or anything, these are the equipments to be provided to him, so that it will be easy for the teacher also to handle him, right? Because they will be having a table format of each and every student, and they will be aware that what to do with this child, because every child is different, every child is not having the same disability. Okay, the disability can be seen or unseen, because autism is a disability which is not seen outside. We have to, if they are sitting like that, we can't say that the kid is autistic, right? But if it is physical disability, then we can say yes, he is disabled. So this is the thing. So based on the impairment, we have to decide that what equipments, what modifications or anything we have to provide to the child. So first of all, there are suppose if we talk of a kindergarten, so there are the steps of drop off, circle time, snack time and rest. So we need to do modifications in each and every area. Okay, now we need to see that how children can concentrate more and how children can get the teacher's words more. Okay, suppose if we are working on the seating of the children, okay, sitting of the children. So if I am giving some examples to you, suppose if the child is having if the child is vestibular seeking, then we can make him sit on the vestibular ball, so that he can get movements which he is seeking while sitting in the class. Then he can concentrate more. We can give him fidget toys to move. If the child is more of visual streaming, then we can give them fidget toys. Some children concentrate more by chewing, then we can give them chewables to chew in class, so that they can concentrate more in the class. And if the child is auditory hypersensitivity, then he will be disturbed by each and every sound in the classroom, right? So in this thing, what we can do is, we can give microphone to the teacher and the earphones to the kid, so that the kid can only listen to the teacher and all the noises around will be cancelled. Okay, so this will be the good idea. So these are the very small innovations which we are doing, but it matters the more in the lives of disabled children, because these things they want to cope up with the mainstream children. Okay, we can use rugs on the mat, on the floors, so that the sounds of the children walking here and there, running here and there can be decreased. We can say them earlier that bell is going to ring, so you should be alert. So they will be alert and they will be calm. Okay, and we can use seating positions, like we can give them cushions, or we can give them sensory mats, so that they can feel the texture if there is any tactile problem. Okay, if they are visually disabled, then we can use braille for them. If there is auditory problem, then we can use the auditory books. Okay, and the next things which we can do innovation is for that story books we can use, because they learn more practically. As I said earlier, that if we see, we learn more. So if we provide different kinds of story books and different kinds of picture of what is there in lesson, then it will be very easy for the kids to understand. I will give you a small example. As we have all seen the movie Three Idiots, in which at last Amir Khan is running a school in which he is doing everything practically, and there every type of children were present. So that is an inclusive school, and that type of management is needed for an inclusive school. So if we teach practically and visual things, showing each and everything, and the schedule of the school, means after coming what they have to do, that everything should be mentioned in a picture, means coming to the school, sitting on a bench, that everything step by step should be in a picture, so that it will be easy for the child to understand that what is the next step now, which teacher will come and teach now, what they have to do now. So this will be easy. So more as possible we have to use visual things. So if the child is not hearing, okay, if the child there is hearing impairment, then there will be a machine, if we click it will read all. So according to the impairment we have to do modifications for each child. So it should be like that it should be suitable for all the children. There should be ramps in the school so that the physically disabled children can go by the wheelchair. In lift there should be numbers with braille also, and so that we can recognize the number with the touch also, so that the visually impaired children can also participate in that. They can also use that and access that. It also have audio of that. Okay, so these type of innovations we should do, and we can use if there are gross motor and fine motor problems, then we can use the slant boards so that they can write easily. If the child is not able to see from the last bench, then we can make him sit in the first bench. Okay, then one more thing, the syllabus should be according to the IQ of the child, and the marking system should not be equal for all the children, because they are not having equal IQ, right? So it should be according to the IQ only. So these are the small innovations that we have to do, and these works, the innovations are very small, but it works great. Okay, so, and what we can do is, suppose so as I said vestibular, so we can use rocking chairs also. And some children, see, walls are there, okay, in classroom. So typical children know that we don't have to cross this classroom, but these children don't know, they have to show. See, these children learn by visual, right? So they need to know what we mean by visual only. So we can make boundaries by the color boundaries, so that around that table, so that they would know that they have to sit in that boundary only, they could not cross that boundary. So they will not roam here, they will not wander in the class. Okay, so these are the few examples that what innovations we can do in occupational therapy. Okay, so occupational therapy, main thing we have to do for these children is visual literacy only, because it supports more, and normal children, means typical children, also learn by this. And last but not the least, I would like to say that every learner matters, and matters equally. This is what we are, this is because we are thinking of inclusive education, because each and every child with or without disability should have equal right of learning. Okay, and this will also increase the awareness in the society for the disabled children, because they are seeing the disabled children from a different view, right? So if we include them in mainstream school, it will decrease, and it will also help the parents of the disabled children to help them to get more opportunities, and they will also be happy because they have to face more in the society and it will decrease. So this much for today. Thank you.